In a world where healthcare is growing in the direction of being very inaccessible, I want to open up my doors and be even more accessible. It's so frustrating for patients to be on the phone for 20 plus minutes trying to get an appointment or to leave a voicemail and not get a call back. I strive and prioritize patients having access to see me the next day, if not even the same day. And if we can do that, that's my number one priority. Minimizing wait times. Nobody wants to wait in the waiting room for hours. It's very frustrating. I would be frustrated. So I make it a point to be efficient in my clinic so that you can be seen in a timely manner. Being personal. If you come and see me, you're going to be like my family, okay? I want to get to know you for who you are, because ultimately, every person has a unique situation, and my treatment plan needs to be tailored to you and your unique circumstance. There are a few things that I feel set me apart. Diagnostically, an MRI is a very traditional and common imaging study done for various conditions of the lower extremity. However, there are a subset of conditions where an ultrasound might be helpful. I have the capabilities in my office to be able to provide an ultrasound, which will help speed up diagnosis as well as improve the accuracy of treatment. For example, treatment that I do is an injection, and if I use an ultrasound, this might help improve the accuracy, therefore ultimately helping improve patient outcomes. An MRI might take weeks, if not months, to get the diagnosis, which would then delay care. That's not the case if we use an ultrasound. Medically, cortisone injections are a traditional and common option to help decrease patients' inflammation and pain. But this doesn't come without side effects. So patients are often wondering, are there any alternatives? Is it worth the side effects that cortisone offers? Platelet-rich plasma, or PRP injections, are an alternative that I offer at my clinic. Essentially, what platelet-rich plasma is, we draw whole blood from a patient in the clinic, we spin it down, and we take the platelet-rich portion of it, inject that back into the patient's body. What research is showing is that this platelet-rich plasma is helping to trigger an increase in the patient's growth factors, which ultimately helps in the natural healing process. Surgically, I offer minimally invasive procedures. With minimally invasive procedures, essentially what we're doing is taking a normal procedure, which normally has a big open incision, and dramatically decreasing the size of those incisions to help with patients' pain and healing process, while also obtaining the same orthopedic outcome. What I find with minimally invasive surgery is that patients are so much more satisfied with their healing time and their swelling, which has really dramatically changed my practice. A case in which I would use minimally invasive surgery typically is with bunion surgery. So with minimally invasive bunion surgery, or MIS bunions, I'm able to correct patients' deformity, have them have a straight toe, decrease their pain, decrease their swelling, while also maintaining cosmesis. Medicine and the technologies and techniques are always changing. Healthcare in general is evolving, and I owe it to my patients to be up to date on those latest and greatest techniques so I can provide the best possible care. Part of the key, I feel, is learning the right time to get involved. You can get in too early, and it could be something that doesn't actually work, but I don't want to be the one who's last in line, okay? I constantly am listening to podcasts, listening to conferences, and reading up on the latest journal articles to find out what these new techniques are and if they're actually helpful for my patients. So I'm very critical. And if I find that a particular technique or new technology can be helpful and I'm convinced of that, I immediately get my hands on it. I get in the lab, I practiced it constantly until I find that I'm ready and confident to be able to apply this to my patient's care.